There are many diagnostic tests that can be done to check for abnormalities in the genitourinary system. A urinalysis examines the urine. Several blood tests are done preoperatively to test for bleeding times, blood urea nitrogen or BUN, prostate-specific antigen or PSA, to name. Other tests can be tissue biopsies, imaging studies, and diagnostic cystoscopies or laparoscopies. The patient's position will be determined by the procedure being performed. The lithotomy position is used for procedures with a rigid cystoscope, such as a 2URP and a uteroscopy. The supine position is for procedures that use flexible cystoscopes and open procedures of the bladder or prostate. The lateral position can be used for procedures involving the kidneys and ureters. And the patient can even be placed in prone position for nephroscopies. Make sure you know all the safety precautions for all the surgical procedures. The lateral position is used for a simple nephrectomy. In this position, the operative side is up, so left nephrectomy, the patient is placed in right lateral position. The bottom leg is bent, appropriate padding is used, and the kidney rest is in place. For the lithotomy position, high or low stirrups can be used. Follow all previously learned safety precautions and lower the legs together to prevent hypotension. An irrigation solution is used as a distension media in cystoscopic procedures. Sterile water is an electrolytic solution used for most diagnostic cystoscopies that do not require ESU or BOVI. Sorbitol and glycine are non-electrolytic and are commonly used when electrosurgery is required for an operative procedure or one that uses resectoscopes. Contrast media may also be added to the irrigation for fluoroscope examination. Regardless of the irrigation used, it should be warm to prevent bladder spasm. There are several instruments that are unique to genitourinary surgery. For instance, a Van Buren sound or dilators are used to dilate the urethra in male patients. A cystoscope is a scope passed through the ureteral meatus for diagnostic and operative procedures. The transurethral approach. The most common cystoscopes are 0 degree and 30 degree. Other instruments used during a cystoscope, or cysto for short, are bridges, obturators, and biopsy forceps. Also needed for a cysto are the video system, light source, and detention media. Surgical instruments for open cases may include plastic, general, thoracic, and GU-specific specialty instruments. The use of special prostatic retractors, stone-grasping forceps, and kidney pedicle clamps may be required depending on the type of procedure and the type of incision being made. Two incisions that are utilized in GU surgery are the flank incision, which is the lateral incision, and the Gibson incision, which is the extraperitoneal and used to access a lower ureter. Urinary catheters are used for short-term urinary drainage, continuous urinary drainage, hemostasis, evacuation of blood clots, and blood. You should be familiar with the different types of catheters. They can be indwelling, such as a Foley catheter, or they can be straight, such as a Robinson, which is a temporary. The three-way Foley balloon catheter is the most common type of catheter used during GU surgery. The balloon holds 30 mL of water and is used for hemostasis. The catheter itself is used for urinary drainage, and the other ports are used for irrigation of blood or blood clots. Urethral catheters have several functions. Some indications for use are to provide the method of instilling a media contrast into the ureter and kidney, identifying the ureters during pelvic or intestinal surgery, drainage of the ureter, or keeping the ureter open to bypass a stone or to allow a stone to pass. Common types are the open-ended, whistle tip, cone tip, olive tip. They have graduated marks so the surgeon can see how deep the catheter has been inserted. A ureteral stent is a particular type of uteral catheter. It is placed in the ureter to provide continuous flow of urine to the bladder and can be short-term or long-term. Transurethral procedures take place in a specialized room called the sister room. These rooms are equipped for procedures that need continuous drainage, fluoroscopy, x-ray, and stirrups. Cystoscopy is an endoscopic examination of the lower urinary tract, including visual inspection of the interior of the urethra, the bladder, and the uteral orifices. A transurethral uropeloscopy is an endoscopic examination of the ureters and the renal pelvis. This provides the opportunity to diagnose filling defects in the uterus and renal pelvis, congenital abnormalities, hematuria, ureteral obstruction, damage from trauma, treatment of the renal calculi, and the removal of foreign bodies. The surgical technologist's roles during these types of cases can be more expansive than during an open or regular surgical case. The ST will set the case and open sterile supplies, then assist in positioning the patient. During the procedure, the ST might open sterile supplies, label specimens, replace fluids, and then after the procedure, help transfer the patient back to the stretcher.